Welcome to the regular meeting of the Public Health and Safety Committee for February 19, 2025. I am Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll to verify the presence of a quorum for this meeting.
Councilmember Payne.
Present.
Rainville is absent. Ellison is absent. Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
There are 4 members present.
Let the record reflect that we have a quorum. I do know that Councilmember Rainville will be joining us shortly. With that, the agenda for today's meeting is before us. First, I will pass it on to Vice Chair Wansley, who will make an amendment to the postponement timeline.
Yes, thank you, Chair Chavez. So we have been able to connect with the City Attorney's Office in terms of getting more clarity around their legal position around why council can no longer advance basically action plans, something that we have had a longstanding tradition of doing in collaboration with the administration, but they have recommended wanting to meet with us before doing a public presentation. So in light of having enough time to be able to do that and accommodate a public presentation, I do want to mend the dates for this postponement with replacing March 5th to sub that with actually July 16th, which gives us more than a sufficient amount of time to get a presentation scheduled.
And can the clerks help me with this process? There's a motion to amend the timeline to July 16.
Mm-hmm.
Is that enough?
Yes, so you just make a motion to postpone to that date.
Cool. So the motion on the table is to postpone to the July 16th Public Health and Safety Committee. Colleagues, is there any questions about that? All right. All those in favor say aye.
Aye.
Those opposed say nay. Any abstentions? And that item is postponed to the July 16th PHS committee meeting. The next item is our first discussion item, and it's receiving and filing an update in response to a legislative directive related to the winter safety for people experiencing homelessness. Here to kick off the presentation is DCCO Brett Jelly, Deputy, and Jerry Jeffries, the Chief of Staff for the Office of Community Safety.
Thank you, Chair Chavez, Vice Chair Wansley, members of the Public Health and Safety Committee. I am Jared Jeffries. I'm the Chief of Staff for the Office of Community Safety. With me today to present on this legislative directive response are Deputy City Operations Officer Brett Jelly, Enrique Velasquez, Director of Regulatory Services, Fire Chief Brian Tyner, Emergency Management Director Rachel Sayre, and joining us shortly will be David Hewitt, Hennepin County Director of Housing Stability. Before you is the agenda of what we'll be covering in our presentation, starting with the city's just preparedness for severe weather, what we're doing now on extreme weather, our role in that, and then Hennepin County's preparedness and services, and then opportunities for preparedness and response going forward. With that, I will hand it over to Emergency Management Director Rachel Sayre to kick us off in the substance here.
Thank you. Welcome, Director Sayers.
Thank you. Good afternoon. My name is Rachel Sayre. I am the Director of the Emergency Management Department. And I want to start by grounding us all in best practices for preparedness for communities for severe weather. The ultimate goal of preparedness work is to reduce vulnerability to disasters and to increase resilience. The key principle underlying our work is that spending time on preparedness year-round on an ongoing basis will help us be better prepared for when an acute disaster or emergency does strike. This time that we spend on this year-round ongoing preparedness work at all levels of our community, individual, household, organizations, businesses, the city enterprise, all of this work will increase our individual and collective resiliency for when disasters do hit. In Minneapolis, of course, when we do talk about potential disasters or acute large emergencies, our most likely risks are seasonal hazards, which means that we can do even more to really specifically focus our work on preparedness for those severe extreme weather events. So knowing that we need to spend most of our time on an ongoing basis on preparedness and knowing what hazards are most frequent, I want to take a minute to talk about best practices for how this work can be approached. Okay, so in looking at what the city can do for community preparedness, I am bringing in my humanitarian experience and that specific lens of best practices that comes from decades of lessons learned from disaster risk reduction, many of which are practices across various sectors in building sustainable community programs. So first, as we consider how we approach this work, we want to ensure it's tailored. So that means that we're engaging with really 3 different groups on any specific hazard preparedness. So first, we're asking who is most vulnerable, either as a group or individuals. And we're asking which organizations are most trusted by those individuals or groups who can help make sure we're tailoring and reaching the individuals who are most affected. So that's the first group. The second group we're looking at is the neighborhood that surrounds those vulnerable groups or individuals. Ensuring that we spend time with both the most vulnerable group and the community organizations serving them, as well as the surrounding neighborhoods, is a consistent lesson learned from disaster risk reduction and response across most every country. And that is because we want to ensure that we're not inadvertently increasing tension within the community by focusing on just one of the groups. So it's really important we spend time focusing and working with both groups. The third group that has unique needs in the same area are local businesses. So like the other 2 groups, this one has unique considerations that we want to take into account when we're designing an effective, sustainable preparedness program. So this first step of defining who we're engaging with is critical because another best practice is that in order to design effective preparedness programs, they have to be tailored. It has to be responsive to what each group needs. And ideally, the whole program is co-created with each of these groups so that it is not us coming and saying, here's what we think, but it is what do you need? What are the strengths you already have that we can build upon? And what gaps can we help fill or address? What cultural specifics, what language specifics do we need to make sure that we're tailoring the skills and knowledge so that we are responsive to these groups, and again, ultimately reducing vulnerability to disasters. Another key characteristic of a successful preparedness program is that it is sustainable. So a well-known marketing principle applies here, that you must hear something 7 times before you consider buying it. Same thing for preparedness. It requires a long-term engagement for people to really consistently take the actions that will help them reduce their individual, household, organizational vulnerability. Finally, the best preparedness programs build on the strengths and resources that already exist in the community. So obviously there are a lot of organizations that are doing incredible work in the city, and we know that, and we want to build upon those strengths and identify where there are gaps. So I lay all that groundwork for us to just have the common understanding that most of what we need to be doing in Minneapolis most of the time is around preparedness. When a disaster strikes, it's really just that quick moment in time. There is that immediate response, there is recovery time, and then we go back into preparedness with lessons learned from whatever came out of that disaster. That is how disaster response, recovery, preparedness works as a cycle. We look at it as an ongoing, forever thing. Okay, so then just grounding us in severe weather. When we talk about severe weather here, we are talking not just about severe cold, but of course severe heat, which actually over the last few decades in Minneapolis, the number of record heat days has outnumbered the record cold days by 3 to 1. High wind events are one of our most likely hazards here in the city. And of course, especially with climate change, we're watching the potential for increased severe air quality days. So those are all the kind of severe weather hazards we're talking about. All right, so moving on briefly to best practices for responses. We want to work towards everyone receiving the same response, regardless of characteristics. So same response, same immediate services. In order to do that, what we really need to understand is everything that's out there already and map it together so that as a whole community, a whole ecosystem, city, other jurisdictions, community organizations, we all know what services we're providing so we can see the gaps and then knit them together to better serve our residents. So the Emergency Management Department worked with regulatory services to talk across 9 departments in the enterprise, the city enterprise, to identify what preparedness actions are already taking place related to people who are experiencing homelessness in the city. As you can see from this list, there's already key and critical preparedness actions that are taking place at this time. I'm going to talk through these first. And then we are going to move into opportunities to enhance preparedness after we each talk through what we're doing now. So for preparedness, the city's homeless response team is already sharing severe incoming weather information directly with residents who are experiencing homelessness. They are also connecting with community organizations who serve those populations. In addition, our city communications colleagues are sharing resources via various social media platforms and newsletters. Our CPED colleagues are funding the county for severe weather and warming stations. And of course, Hennepin County is here or will be here shortly to also provide what role they play in this ecosystem. So with that, I'm going to hand it over now to Chief Tyner, and then I will come back shortly.
Thank you. Welcome up, Chief Tyner.
Thank you. My name is Brian Tyner, Fire Chief of the Minneapolis Fire Department, and we're going to talk about primarily response of the fire department towards encampments, which is what we were specifically asked about, but a little bit about prevention too. So our response to active fires in encampments during severe weather is really pretty much the same as our response to active fires in structures. Our first responsibility is life safety, so rescuing any victims or anybody that's trapped in a burning area. Extinguishment of the fire is our next priority, and removing the hazard if there is one that needs to be removed. After that, we also do provide emergency medical responses whenever we're called out for a variety of medical issues, whether that's involved with the fire or not. But in extreme weather and severe weather, we also partner with Metro Transit to provide buses to serve as warming spaces or cooling spaces if it's a hotter day. And we also call American Red Cross to provide wraparound services to victims displaced by a fire. So that could be for people who are actually in a building that assistance could come in the form of a voucher. For people who are living in an encampment, it usually comes in the form of tents and sleeping bags and other materials to replace what was lost. So with that, and for prevention, we do visit encampments upon request to just kind of determine if, they're using safe practices, safe heating practices, that there's enough distance between open flames and flammable materials and things like that. We've also recently partnered with the National Propane Association to distribute information about safe propane use, since that seems to be the preferred heating source here now in many of the encampments, and we think will help to reduce the number of fires in those encampments. So with that, I think I will pass it on to Enrique Velasquez. Thank you.
Thank you, Chief. Welcome, Director Velasquez.
All right. Thank you, Chair Chavez, Vice Chair Wansley, and committee members. I'm Enrique Velasquez, the Director of Regulatory Services. And I'll talk about the role of the city's homeless response team during inclement weather, whether it's extreme heat, extreme cold, or other variables such as severely poor air quality as we have experienced. So first off, the city's homeless response team, they meet on a weekly basis, multiple times throughout the week, with other city personnel that are out doing outreach, whether it's crime prevention specialists, it's solid waste and recycling, or others within the city that are engaging in this work, in this space. That also includes external partners that are engaging with community members from Hennepin County through their street outreach teams, Metro Transit's Homeless Action Team, and MnDOT and their outreach teams as well. So constantly working in collaboration with each one of these partners to understand what the needs are as these different critical events emerge, what the resources are that are available, and provide some level of direction so that we all know what the resources are, how to access them, and how to engage with individuals experiencing unsheltered homelessness at encampments or otherwise. We also rely on the county to gather some of the information so that our outreach teams are out in these different spaces delivering that information, providing resources and information to people experiencing unsheltered homelessness so that they know what exactly is happening, where to go, how to access these resources, and even providing either vouchers or bus tokens or a variety of different methods to go in and reach those specific services so that transportation to that shelter or the cooling space or the warming place is not a barrier all by itself. Additionally, we know that there are about 85 Arctic shelter beds that come open when there's extreme cold. So those are in addition to the existing winter shelter operations that provide just additional access for individuals experiencing unsheltered homelessness that need a safe, warm place to go. And then with that, I will turn things over to our colleague, David Hewitt from Hennepin County's Office for Housing Stability.
Thank you. Welcome up. Thanks for being here.
Good afternoon. Thank you, Chair Chavez, council members. My name's David Hewitt. I'm the Director of Housing Stability at Hennepin County. I was asked to speak here today given the county's role that it has taken on really leading financial investment in shelter and the homeless response system. With that said, I did want to just start out by kind of highlighting that the way that we think about homelessness response is that any incidence of homelessness is an emergency in need of response, irrespective of the specific weather of the day. I just want to highlight that because the work is year-round and that plays out in some specific ways. For instance, we have had winter-only shelters in the past, such as the one operated by Agate Housing and Services at First Covenant Church, that we converted to year-round shelters because that was a better operating model for the people it serves and for the staff. So our preference and priority, based on what we hear from the people that we work with, is year-round services rather than weather-specific services. But we do both, and I'll come on to that. The only other thing I'd like to say about year-round operations is I always say that the best thing that we can do in advance of an emergency is actually ensure that there are as few people exposed to it as possible. We're just tallying the final numbers from 2024 across all of our programs, all of our non-profit partner programs, and we can see across last year 2,522 men, women and children exited homelessness to permanent housing. I just mentioned that because, of course, that means more than 2,500 people were not in a position to be exposed when an emergency hit at the start of this year. So we always want to highlight the importance of that year-round work. That said, on the day of an emergency, I'm going to talk about what's available immediately. First thing to note, because it is noteworthy, is that Hennepin County is the only jurisdiction in the entire Midwest, one of only 4 in the United States. It's ourselves, Washington, D.C., Boston, and New York, who operate under a shelter-all policy for families with children. What that means, unlike anywhere else, is that we expand capacity for any family with children that would need shelter that night so that no child sleeps outside. That has seen us ramp up capacity as we did across 22 and 23 to the point where we were at more than 400% capacity, leasing additional buildings. It also means we sometimes see a reduction just based on need reducing as we did across 2024 when the numbers reduced by more than 50% as more families were leaving shelter every month than new families coming in. Turning to single adults, which is most of what we would be talking about here, the county is the primary funder, but not the only funder of non-profits that operate single adult shelters. Our total county funding going into the shelter system as a whole has increased for what it's worth. Since pre-pandemic, it was about $15 million a year, 15. Today, it's closer to $50 million a year, 50. A lot of that investment has gone into improving the quantity, quality, and variety of shelter options. So we added 4 new shelter programs with our partners over recent years, helped 3 existing shelter programs build or acquire new buildings, invested in the physical facilities at others, and helped a number of them, the likes of Simpson Housing Services, Agate, Pieces of Salvation Army Catholic Charities, to move to 24/7. Again, those were long-standing changes because they are better for our residents. And it used to be the case, going back a few years, that when winter hit, all of these shelters would have to scramble to work out how they were going to stay open all day. Now that that is the standard operating model for most shelters, we don't have that scramble. Turning to access of shelter, another big reform that happened pre-pandemic that plays out in an emergency situation, it used to be the case that every day people would have to queue up outside the big shelters in order to gain access. And every next day they would leave and not know if they were going to get back in and would have to queue up to be first come, first served again. And even the smaller shelters operated under a lottery system, a literal lottery ball system, once a month to get in. We worked with our non-profit partners to reform that system pre-pandemic so that now folks in shelters can re-reserve their bed for the next night. And to the first bullet point here under access, of course, the best indicator that somebody is going to need emergency shelter tonight, and let's say there's an emergency coming in terms of weather, is that they needed emergency shelter last night, right? And what we see is more than 90% of people re-reserve their bed. So they don't need to go through that rigmarole and that uncertainty in the past of having to go out knowing they will have to come back and queue again. So the vast majority of people accessing shelter used it last night, used it the night before. At the same time, we know that there are people experiencing unsheltered homelessness in a variety of settings. So we have staff and we have contracts with non-profits to do outreach into libraries, on transit, into encampments on a daily basis so we can help those folks navigate a way into shelter if that's what they wish. At the same time, we know we need to have a system that anyone can access from wherever they are, and so we promote that far and wide, and that's the phone number you see on here, Hennepin Shelter Hotline. It's a partnership of Catholic Charities and Simpson Housing Services under contract with the county. Every day, Catholic Charities assist folks with finding alternatives to shelter. They manage to do that for about 40 households a week. So about 40 households, about half families, half single adults, call up the shelter hotline saying we need shelter. And they actually, with a bit of creativity and some flexible cash, help them find an alternative to going into shelter, whether that be through family, friends, or some other means. For those that cannot be provided with that and still need somewhere, single adults connected to Simpson and Simpson access shelter beds across the participating partners. On average right now, what we see is 62 shelter beds become available each day for new people. This is the data that Simpson provides to us as the county, which we then collate. It fluctuates from day to day, and there are 2 points in the day when shelter beds become available. Right now, the average is 31 beds available for new people not those that stayed in shelter last night, but new people every morning, and 31 in the evening. But like I say, there's fluctuation. And then there are specialist shelters that operate under their own intake because of their model. Avivo Village specialises on folks coming out of encampments, are partners with Outreach. That doesn't go through that phone number. The American Indian Community Development Corporation shelters that Hennepin County has funded, we look to AICDC to dictate the best way for them to serve their community, their cultural expertise, so they operate their own intake. The medical respite shelter offered by Catholic Charities partners with Healthcare for the Homeless to prioritise folks with medically acute needs coming out of the hospital system. That's what the general system looks like. A couple of quick slides. So it's already been mentioned we had a request for proposals for additional winter services. Like I say, the preferred model is year-round. That's what we've really invested in. And we know that there will always be a need to stand up additional capacity in the winter. We had a request for proposals last summer. Just a bullet point on here, but we always want to highlight people with lived experience of homelessness participated in the funding decisions. We did fund 3 programs that offered additional overnight capacity through AICDC, Rescue Now, and some Arctic beds at Salvation Army. Collectively, they added 140 beds across the whole winter. I will add, we don't generally go into the details of RFP processes, but these were the only proposals we received for additional overnight capacity, so we prioritized them. We were able to additionally fund a couple of extra daytime centres, and those are the 2 on here, Hope Avenue and Steps of Strategy. There's also a link here, a QR code. That will take you to a page that captures everything I've shared and more. We try to host information from across our community, so if churches are opening up in the day and they let us know and they're happy for that information to be shared, we will share it on there. Library opening hours are shared on there, as well as homeless-specific programs. But we just try to collate all of that information where we can update it in real time about what shelters are available, what daytime centres are available. But these were the couple that we were able to specifically fund through this winter. So I think that's everything I had to share today, council members, but of course happy to take any questions. And I'm not sure who I'm handing back to.
Thank you. I think maybe we can, are you going to stay here, David?
I'm here as long as you need me.
Okay, maybe I think what could be smart is if we transition to questions, just so you can leave if you need to leave. But otherwise, we can finish the presentation. I just want to make sure.
I will defer to the presentation. I'll wait for the presentation.
Okay, thank you.
I appreciate the update.
Yes. Back up.
Okay, thank you. Not too much more. So we are going to transition now into talking about opportunities we have to enhance preparedness. We've identified a few specific projects that EMD will be implementing over the coming year in this space. So first, we're going to work across the enterprise to develop holistic seasonal hazard preparedness messaging. And that would be deployed across currently available communication avenues. So newsletters, social media, all of these kind of things, but it would be proactive ahead of every season, really just providing some key best practices, again, from across all of the departments, so residents have information they need to be better prepared. We estimate that we can probably accomplish this within 6 months, assuming no major disruptions, and using resources on hand. So the next item, the next project we're going to tackle is working to develop triggers or thresholds for severe weather events. So when we hit X degrees, or we're expected to hit X degrees, then the following communications will happen, the following actions will happen. We want to do that across the severe weather hazards, to the point where ideally, acute severe weather events will become more routine with reduced impacts. The next project we're going to undertake is something that I am bringing from the humanitarian response world, which is called a 3 Ws. This is a tool that serves as a house for what organizations are providing what services where. 3 Ws. Which organizations, what services, where. The idea is this tool is usually stood up at the beginning of a humanitarian response, and it helps the whole response ecosystem know which residents are being served with which services, and it helps identify gaps that can then be closed more clearly. It also helps all parts of the ecosystem that is responding know who is doing what, so you have less duplication in the end as well. So for this line of effort, this is a big project, obviously, but we would lead the development of a 3W specific to our collective ecosystem efforts around severe weather for people experiencing unsheltered homelessness. This would include, of course, working with the city, county, other jurisdictions, community organizations, to get to that point where we have a holistic view and can better identify gaps and who is doing what where. This is a very large undertaking, so I'm estimating 12 months. We hope that will be achievable, but we definitely believe this effort will be worth the time and will put us collectively in a better place. Finally, the last effort that EMD will be working on is to enhance preparedness related to co-creating preparedness engagement with these three different groups that I talked about at the beginning. So we would like to engage with each of these groups and talk about how we can build on the strengths and services they're already building, and where we can knit together services from across the whole ecosystem to better serve our residents. And again, ultimately, our goal is to reduce vulnerability and increase resilience in this space. So now I'll hand it back over to Director Velasquez to talk about opportunities to enhance our response.
Thank you. Welcome back up, Director Velasquez.
Thank you. So earlier on, we talked more about the reaction or the immediate response. And as we shift over into how to be more proactive and prepared on how to respond, we identified opportunities to increase visibility, increase identification of thresholds that are approaching. So rather than wait until a weather event happens and then react in that moment, identifying when we anticipate that those weather events are going to happen, identify communication methods so that we can be proactive at engaging with not only our partners, but then also the individuals experiencing unsheltered homelessness, the affected individuals in encampments or in a variety of different living situations that are less than stable, so that they know what tools and resources are coming available, they know when they're coming online, and how we can collectively help them navigate through each one of those different avenues to be able to access them. Second is cascading of communications. Hennepin County, as you saw from the QR code, or if you've had a chance to navigate through their site, have a wealth of different resources available for individuals on sheltering, on storage, on a variety of different services. Being able to cascade that communication as broadly as possible that's language specific for individuals that are in need will be a huge benefit for every single member in the communities that we're serving, so that they know where they're located, how to access them, and physically helping them access those different resources. That would also include storage options. I know at various points people are reticent to take indoor shelter because of the limited amount of storage that they're able to, or belongings that they're allowed to take with them into the shelter. And it's their personal belongings, it's their effects, it's everything they have. So trying to find pathways to help them do both, secure their belongings and avail themselves of the available resources for sheltering. And then I'll turn it over to Chief Tyner.
Welcome back up, Chief Tyner. Thanks, Director Velasquez.
Thank you. So not realizing that this slide was in there, actually already covered this, but again, working in partnership with the National Propane Association, we have developed coordinated safety messaging to deliver to homeless encampments and other people to talk about safe propane use. And we've also talked about partnering. Well, I didn't talk about that. We're going to partner with the Regulatory Services Homeless Response Team to help get that information out too. So it's not just being passed out by the fire rigs, it's also being passed out by other parts of the city. And so we think with that collaboration, we'll be able to get a lot more information out. Let's see if there's any more surprises in here. All right. No, I think that's it. So we'll stand for questioning.
Yeah, thank you all so much for the presentation. I'll first pass it on to Councilmember Rainville.
Thank you. Chief, I just wanted to pass on my gratitude and recognition of the bravery and courage of your fire department, just as recently as yesterday with the three separate fires. I can't imagine being a firefighter in this cold weather where your equipment freezes up. You have to call in reinforcements to take shifts putting out these fires, and the sensitivity you show towards the citizens. Nobody got injured or much less died as a result of the bravery of your firefighters. So please, if there's any way you can tell them that the City Council appreciates what they're doing, that would be wonderful.
I absolutely will, and thank you for that.
Thank you.
Yeah.
Next up, we have Vice Chair Wansley.
Thank you, Chair Chavez. Also, a question. Actually, sorry, not for you, Chief.
Okay.
First, starting with Director Hewitt from the county. Yeah, thanks. So really good to hear about the 2,500 figure that was served last year, and that's coming into permanent housing this year. I did want to know if you all had any updated figures on just kind of the lay of the land of where we're at for total population in the county for unhoused residents. I know there was a figure shared, I believe, about a year and a half ago, where it ranged between 450 to 700 or so any given night. So just wanted to get a sense of kind of where we are going into 2025.
Yeah, thank you, Chair Chavez, Councilmember Wansley. The most robust figure we have for the number of people experiencing unsheltered homelessness is the annual point-in-time count that gets undertaken every January. Okay. And this is a number that the count happens over several days, but focuses on one night in January. And it's happening all across the country at the same time. So by the time you get to like that December report that people will have seen in the papers where the federal government give the annual count, that's based on last January's count. Mm-hmm. So you do the count in January, you submit the numbers to the federal government in April, May, there's some cleanup through the summer, and then they publish them in December. What that means is the most recent kind of vetted, robust number we have is still the January 2024 number, which was 496. Okay. That was slightly up on the year before it, which had been 469. The peak number was 2020, which was 642. And council members, you've probably heard me use the caveat before that all data is flawed and some of it is useful. I would always say of the point-in-time count, it is not a perfect census at any given point. What it is broadly the same methodology being used year after year after year and across the country. So it's a better indicator of trends and trajectory than absolute number, I would say. In terms of the 2025 number, we are working on it right now. Because I know that pieces of it getting worked on by data analysts. I did a couple of point-in-time count shifts at Central Lutheran and at the old Agate Food Centre. So the process is well underway, but I'd be reluctant to give a number today, knowing it could still shift over the next couple of months. But we'd be happy to come back as soon as the number is at least final enough that we're submitting it to the federal government. Beyond that point, it can still change. It doesn't tend to change very much.
Okay, that's good to know about that figure. I just want to know if there was any substantial changes, especially in light of factoring. Well, it was good to see also just an overview of services or providers that you all are working with too around emergency preparedness, also year round, and also knowing many of those providers, and I think also the county is impacted by this too, and the big financial cliff too, in terms that we're all concerned about, and the likely impacts of that, like with Agate housing and the potential loss of additional beds and how that might impact that figure, or if we're seeing any potential providers look like already having to close down, and if that figure has adjusted or changed since. Yeah.
Yeah. Thank you, Chair Chavez, Councilman Wansley. I think to this point about financial cliffs and provider difficulties, I mean, one thing I'll say is, I've been here now 8 years. Each year we have new programs opening up. We also have programs that close or contract. So there is a natural ebb and flow that has occurred certainly over that period. And different providers and different programs are in different positions. I think what is unique to this moment that is challenging is we have come out of the period of pandemic recovery funding, which was providing about $13 million a year to a lot of the new initiatives that were launched during the pandemic, like some of the ones I referenced, the American Indian Community Development Corporation Shelter, Avivo Village, and others. And that has not been replaced. There is once more going to be a bill at the legislature looking for more robust funding for homeless services across the entire state, and Hennepin County have made that one of our priorities to support, so we're working with our representatives there. But that financial cliff is still very real and is currently being bridged primarily with some support from the city as well, primarily through Hennepin County use of general fund, which is kind of one-time money coming from reserves in the 2025 budget year. Of course, we have the larger unknown of the federal picture, which, as of today, we know that new agreements haven't yet gone out for projects that will need to renew their continuum of care funding. We had the freeze and then the rescinding of the freeze a couple of weeks ago. I don't feel able to kind of speculate today as to how all of that will ultimately play out, but of course it's an cause for elevated concern, and for any programs or providers that are looking at finances in a context of, inflation has increased a lot of costs, revenue haven't kept pace with it, and then you have these other risks in the world around your revenues. It is certainly something that we want to pay close attention to, and it is the reason we're prioritizing measures at the state legislature that might mitigate somewhat.
Yeah. Thank you so much, Director Hewitt.
Thank you.
I did have a follow-up question, too, for Director Sayer. Also, just a question in terms of, I was interested and was hopeful to see the role of the health department, either locally or the county. And when I'm thinking of health, also the medical components, I think one big aspect that we also see with the severe coldness, and I've had the unfortunate opportunity of seeing this also in person, is many of our unhoused folks are losing limbs, like experiencing hypothermia and frostbite from being outdoors. And how does that correlate then to hospital or emergency room visits? And is there any mitigation to be done there? I mean, I know that connects to, of course, with the fire department around the propane use of people trying to find ways to warm themselves, and then the warming centers and things of that nature. But just wanted to get a sense of how we're looking at bringing in our medical providers into this response, if there's any educational awareness, any resources there that we should be thinking through, because I remember also seeing a study that documented also just not only the loss of limbs to that, but also the impacts of hypothermia and exposure to extreme cold weather, how that also leads to long-term impacts on folks' brains, and how that can result into various disabilities and other health impacts and impairments. And So I wanted to get a sense too of is there space? And I know we're going to connect with Chair Chavez and having an update from you all on this work in the coming months. But I would love to also see that role or have that perspective be reflected in their emergency preparedness too, because that is such, I think, a visible component that we have seen at encampments too, that many of our residents have seen, that medical providers are seeing, and that often isn't highlighted, especially in like people do go to our emergency rooms to seek shelter too. So yeah, just wanted to get a sense of how that is being considered and factor into the work that you're doing around this area.
Thank you, Chair Chavez, Vice Chair Wansley, for that question. So we absolutely met with the health department as we have been undertaking this effort to look where we can enhance our across enterprise preparedness efforts. And so absolutely this work on thresholds and then what actions fall from that will be health and us will be hand in hand working on that for exactly those reasons that you mentioned around the health impacts of severe weather. I definitely see a space for us as well to work with our health colleagues, the city and county, around metrics. I'm hoping that's where we'll see that our efforts over the long term will be making a positive impact. We'll be able to look at things like hospital admissions and such, and hopefully see that our engagement in linking the whole ecosystem of services in our preparedness efforts, that will make a difference over time. So absolutely, we are working together, and health expertise will be a huge part of making this a successful effort over the long term.
And then following up on that, and I believe you dive into that on slide 16, I did want to get a sense, and maybe you spoke to it and I just forgot, were you looking to bring in a consultant to help with the development of the 3 Ws? I know because that's such extensive project defined by the 12-month timeline that you all are taking on. Was that something that you're looking to develop in-house as like a comprehensive plan? Or I see it as like the gaps in service analysis that the NYU policing report just did for OCS. But again, they brought in a research, organization, through NYU to do that. So just wanted to get a sense of how you all were looking to go about getting that part or recommendation completed.
Yeah, so the back end of that is really building a database. And at the moment, everything that we talk through here, we are planning to do our best to do in-house with resources on hand.
Okay. Great. Those were all the questions that I had. Thank you so much.
Thank you. Next up, we have President Payne.
Thank you, Chair Chavez. And this presentation was really helpful because it's really highlighting the degree of coordination that's necessary to have this type of response. And I think it's also enlightening. It's not just the coordination between city and county, which I think most people kind of understand. It's the level of coordination that needs to happen within the city, right, between departments. And I'd also want to extend, there should probably be some coordination between council and departments as well, because some of the opportunities like, more proactive outreach can be done within a budget, but there's going to be some items that probably need some additional resources that I think we should be proactive about and coordinated around. But the thing I'm also wondering, and I don't know who's the best to speak to this question, how are we inviting not just the service providers that we know, but other people who would want to be able to activate and have them be activated in this space in a more coordinated way. So there's a lot of community members that in their own personal time are offering mutual aid. There's, fairly organic, they're not part of a formal nonprofit, but there's quite a few groups that are coordinating meals, coordinating warming opportunities. How do we invite them into a more formal, coordinated response rather than have it be more of this kind of ad hoc, organic, community-led thing?
Welcome back up.
I think I'll take that question. Thank you, Chair Chavez, Council President Payne. So it's a great question. That is something that we are wanting to pull from best practices across the enterprise. So we've spoken with NCR a little bit about how they do community engagement, drawing from them. Some of that, again, will come from best practices, lessons learned that I'm bringing from my previous experience. And certainly we're open to ideas on how to do this best, because we do want to capture the whole ecosystem. Like you said, those neighborhood mutual aid organizations that are so key when an event happens. So I can't tell you at this moment what precisely that will look like, but the first thing we're going to be doing is just creating a project plan that really, in phases, lays out how we're going to pursue this work. And one of those first things will be figuring out how do we capture the universe of what's happening.
Yeah, because I feel that in the years since most of us have been up here, there's been quite a lot of conflict and tension between community that's really authentically showing up for our unhoused neighbors and a conflict point with the city as an institution. And I feel like we really need to invert that relationship, because a lot of those community members really, really are passionate about looking out for their neighbors. And it's often received as some sort of hostile thing, when what they're really trying to do is bring like food, resources, sleeping bags, tents. And I think if we could better support some of this organic support that's happening, it would make for a more robust city response and regional response, frankly.
Thank you. I appreciate that.
Anybody else on queue? Awesome. Well, I am kind of up to it, I guess. So if we go on page 14, it talks about, maybe this kind of talks about what Council President Payne was talking about, but it talks about co-creating sustainable disaster preparedness engagement with community groups based on their unique needs. And I kind of want to learn a little bit more about the thought process on this. I think this is a good idea, because I think it could help us work with folks that are on the ground with individuals experiencing unsheltered homelessness, folks that have the trust of people that are experiencing unsheltered homelessness, to actually like develop a plan that would be more effective, I would say. So I think Council President Payne brought up a good point, and I think if you maybe could tie it to the slide, I think that's kind of what he's talking about too. But it's slide number 14, and I think there's an opportunity there if I'm reading that correctly.
Thank you, Chair Chavez. I think this is I don't have a slide number, so I think this is perhaps the one that we're talking about, just so I make sure.
Oh, okay. It might be 17 on the revised, but it's opportunities to enhance preparedness, co-create sustainable disaster preparedness.
Thank you, Chair Chavez. So, I'm happy to talk a little bit more, especially just coming from my background in humanitarian response, what this looks like. But the first thing here is really figuring out who is in this group, right? So, and then building out, as we were just speaking, who else isn't engaged with these groups but is doing the work, and maybe they're just not quite connected in yet. So really mapping out the universe of everyone who has a piece in this is a first part, and then segmenting again into these three different groups. So if we're just going to focus, for example, for the moment on the community service providers who are providing services to unsheltered residents, we know that they're already doing so much work. So what are the things they need that will help them better provide services? What are the needs that they see that are greatest? What are the needs they see that are specific to one location versus another that we can then help address? So it could be things like this specific group of unsheltered individuals has accessibility needs that when severe weather hits, they need XYZ services. Okay, then that can help us focus our preparedness efforts on that specific set of needs, and better link organizations that are providing those, that could provide those services, as well as provide information on here's how to help individuals who have these kind of needs better prepare for severe weather. So the more we can engage with folks and understand what they need versus us telling them what they need, the better off everyone is going to be.
Agreed. Thank you very much. I do appreciate that. And I have one last question, but it's not for you. Director Velasquez, I think the next slide, it's about cascading communications to community partners. It talks about where they're located, how to access them, and ways to get there. I think this part is really important. Do you have a timeline of how you think this would work and like the plan for that?
Certainly. Thank you for the question, Chair Chavez. So with respect to ways to get there, we're working on that currently through a variety of different avenues, such as either a contract through Uber or Lyft or other transportation partners to be able to help individuals get access to those resources when in that specific moment they say, yes, I'm ready to go to shelter. We want to be in position and able to help navigate that to get them to those sheltering locations in that moment. Because recognizing that it does take effort, it does take a lot of time to build that trust and for that barrier to come down, we want to be there and be in position to help them when they're ready to accept that help.
Sure. Thank you.
Sir.
I don't think I have any more questions. I think, one, I just appreciate the presentation. Thank you all for bringing this comprehensive presentation over and a quick turnaround, because I know we literally drafted the directive a couple weeks ago and you all came back pretty quickly. So I do look forward to the implementation of some of the opportunities to enhance, and when it's time to come back to the city council and give us an update on that, because I think that's really important. So I just want to show my appreciation to staff for the work that you all did on this today. And I'm going to look at the queue. Councilmember Palmisano.
Chair Chavez, I'm sorry, I wanted you to have the last word here, but something that you had asked prompted a question that I had from Director Velasquez, which is the bigger context of this is that our unsheltered homeless population accounts for 5 to 7% of our total homeless population, right? Like, I think it's something like that, and it's a county figure, but nonetheless, I think it's 5 to 7% of our of people experiencing homelessness are living unsheltered in our community, and the rest are in some sort of shelter, and maybe that's more living with Director Hewitt. It might also be a question for Director Hewitt to level set this, because it is important context to set, right? There's a certain percentage of those unhoused, right? That number was, I thought 470 something from our last data set. But that's only representing like 7-ish% of our total people who currently are experiencing homelessness, whether that means sleeping on somebody's couch or being in one of the Hennepin County shelters or one of the community partners shelters. The number is much larger. So I'm curious if, as we look at at emergency figures, when it's extremely cold or when there's air quality events, how is that the rest of this population shifting around, right? Like, are people that have been accepting a shelter bed that is just a very temporary shelter bed, making different decisions, not to obviously go live outside during those events, but do they feel more ready to move into more permanent housing options? And I'm curious if, despite these terrible, tragic scenarios, if sometimes these severe weather events actually change the mindset of those that we've been working with, your homeless response team and others, where we've approached them several times in the past and they're not willing to take shelter, that all of a sudden that's kind of like a turning point moment where then they are willing to get into a sheltered situation. Can you comment on that? I'm just curious from the experience of what we've seen over this past year, if these severe weather events end up being turning points for some of those that are living outside or not.
Certainly. Through Chair Chavez, Councilmember Palmisano, I'll speak to more anecdotally to the experience from the homeless response team engaging with individuals experiencing unsheltered homelessness and what they've seen through the specific weather events. And then I'll certainly invite my colleague, Director Hewitt, up to address more of the broader components of what that specific number, 496, represents within the overall ecosystem of people experiencing homelessness, whether it's sheltered or unsheltered. So the experience that I can say that the homeless response team has experienced is when there are some extreme weather events where people are living outdoors, living unsheltered, people are resilient. They do find pathways to get into shelter. They do, not all of them, but there's a good number that do seek shelter, either with a family member, sofa surfing, or moving into shelter, finding pathways to get into shelter, even if it's a temporary respite for a day or two. That is the direction that we have, by and large, seen happen. Even with respect to the different events that prompted this specific legislative directive. We had the extreme weather coupled with a couple of fires that displaced a number of individuals, and we saw them move to indoor spaces, initially to the Metro Transit bus for a few hours before being able to go into the Minnesota Indian Women's Resource Center and also to the Agate Food Center, which also opened up early to allow for some temporary respite. So we do see people moving indoors when extreme weather does happen.
And so, Mr. Chair, do you see that as just being temporary and then they wish to no longer be in a shelter, they don't want to live near other people, or all of the different complicating reasons as to why they're living in encampments or living outside? Do they return to that, or is there any sticking power to, now that I'm in a shelter, it's some of my fears have dissipated, or I've been able to get more wraparound services kind of help, and now I'm ready to make a different decision?
Yes, through the chair, Councilmember Palmisano, we do see that it depends on the specific experience and also the experience that they have with that shelter or in that specific environment. In the case of the Minnesota Indian Women's Resource Center, additional outreach, additional engagement descended on that specific location that helped individuals make a different decision versus returning to an encampment type of a setting. So it's when all the different elements are there to make a really strong recipe for success, then we do see people make different decisions and move forward in seeking housing on a more long-term, stable basis.
Yeah, thank you. And Mr. Chair, just point that out because I think that is maybe some of the good news in these bad situations, that we are getting some more people then into a housed situation. But it's tough, and we want to set those conditions such that we can capture as many individuals into a more housed environment as possible. So thank you.
Certainly.
Thank you. And I had a few more things I want to talk about on this item. I think that, oh, Director Hewitt, yes, please.
I just, hearing numbers get thrown around, I was wondering if it would be helpful for me to kind of, and I'm happy to share a perspective on that previous question as well. So I mentioned earlier on the last point in time count number for unsheltered homelessness was 496. It is important to note that that is all people experiencing any form of homelessness in what we call a place not fit for human habitation. So that is much broader than encampments. That would include anybody sleeping on the light rail or a bus, in a doorway, walking the streets all night, in a vehicle at a rest stop, which may happen in the suburbs as well, does happen in the suburbs as well. So of that 496, the proportion that are in encampments, we typically estimate being around about a third of that number. So in the kind of 150 to 200 range. So that's that subset of the count that is people experiencing unsheltered homelessness. The total count for people experiencing homelessness, unsheltered, sheltered, and transitional housing, because this is what HUD focuses on, does not include folks sleeping on their on couches and staying with other people. But across those categories, the total count for 2024 was 3,866. So more than 3,300 in shelter and transitional housing to that number of 496 unsheltered, of whom are sub-Saharan encampments. So to your percentage point, Councilman Palmisano, I believe what we see is around about 87% of people in shelter or transitional housing, about 13% in all places not fit for human habitation. But if we drill in to focus on encampments, then you're absolutely right, it's more in that kind of 5% of the total count range. Just for some national comparison, because the most recent federal report had the highest homeless number, the highest unsheltered number, the highest shelter number, all of it for 2024. At a national level, about 2/3 are sheltered against 1/3 unsheltered, so much higher proportions of people experience unsheltered homelessness in other cities. Indeed, if we look west from here, we see cities with 10 times the rate of unsheltered homelessness that we see as a share of their population. To the other part of the question about are people perhaps more ready to make a change in this environment, I think anecdotally we see that, and people are complicated, and the reasons that people might be ready for one thing at one time and another thing at another time vary. Our goal, of course, is that you're ready in that moment to connect them. And what we do see is that whatever the kind of the tipping point is, if we can get people into permanent supportive housing in particular, rather than shelter or transitional housing especially, but permanent supportive housing, the success rates of not returning to homelessness are very, very high, more than 90%. So that's kind of the gold standard we aim for. But getting anybody indoors, especially in weather like this, is a success, of course, even if temporarily.
Thank you. I just know that it will be a different experience when we are able to connect these resources to people than when they show up in an emergency room, for example, which would be a very temporary experience.
Thank you. And on that note, I did want to flag that there were multiple emergency pop-ups that opened, and which led to this legislative directive being created. So we had GMCC, different churches, MIWRC that had to open up on their own accord because there just wasn't capacity to move people indoors. So there were people that were freezing outside in the cold, and community members had to literally come together without support from government to say that we want to make sure that people are not being impacted by the cold, that people have a place to sleep, or at least temporarily move indoors. So I think that is something I just want to highlight with this directive, that people were able to temporarily move indoors for maybe a couple hours or a day, but that's because there were community members that came together and said that we need to build more capacity because there just isn't enough capacity in our system right now. And I just want the public, there's a Good Start Tribune article that was released on January 11th of this year that has a title, "With Homelessness Shelter Beds Fully Booked, Hennepin County Has Stopped Tracking How Many People It Turns Away. There are more than 800 emergency shelter beds available for single adults throughout the county, but when the homeless people call the hotline, they're often greeted with all beds are full." It goes on to then say, Hennepin County's emergency homeless beds continue to fill up at key times despite a refrain from public officials that shelter is available for all who seek it, according to unsheltered people, their advocates in the county's own hotline. And I think that is something that I just want to read out loud today because it continues to be capacity needs to expand in our shelter system. It is impacting unsheltered residents when it is cold outside, when they can't find a place to move indoors. It has led to multiple locations having to open up because there is no capacity, like MIWRC, different churches that we worked with. And I think the reason I'm saying that is because there is a clear gap that is missing, and I think there's an opportunity, though, that we get to work on figuring out what are those gaps, how do we address it, and how do we work with different partners, which is why I'm thankful that this presentation came so quickly from our staff and the work that was done, because there is timelines on how we could get some of this stuff done that could literally save people's lives. So I did want to, again, show my appreciation to staff for this presentation. I did want to highlight some of the things that are happening in the community right now because people are being impacted, and I think there is ways to work together, and I'm especially excited about the community component of that engagement because I think there's an opportunity to actually partner with the people being impacted organizations that help people being impacted, and I think there's opportunities for growth. So that is exciting. All right. I don't think anybody is on cue. So, seeing no further questions, I'll direct the clerk to receive and file that report. And thank you, staff, for the presentation. We appreciate it. The next item is receiving and filing a report from the city's Human Trafficking and Substance Use Awareness Campaign. Here to present on this item is Heidi Ritchie from the Health Department. Welcome up, Deputy Commissioner.
Thank you, Chair Chavez, Vice Chair Wansley, and members of the Public Health and Safety Committee. My name is Heidi Ritchie. I'm the Deputy Commissioner of Health for the Minneapolis Health Department. With me, I have Suzanne Young, the Program Manager for the Opioid Response Team, Sunu Shrestha from the Racial Equity, Inclusion, and Belonging Department, Beth Holger from the Link, Carol Russell from Russell Herder, and Commissioner Chaplin. We're here today to share the Sex Trafficking Thrives in Silence campaign. This campaign was a collaboration between the Departments of Health and REIB with funding from the state of Minnesota. We are deeply committed to fighting human trafficking and protecting the most vulnerable populations in Minneapolis. This campaign focuses on raising awareness with a particular focus on sex trafficking and sexual exploitation and their intersection with substance use disorder. Although this topic is one that often leaves people feeling despair, these are messages of hope and help for all of our victims, survivors, and their loved ones. This work first began, as I mentioned, with some funding from the state back in June of 2023. We held a convening that brought together individuals with lived experience, service providers, and policymakers. It featured keynote speech, expert panel, networking luncheon, focus groups, and a call to action. What we did was explore that complex relationship between human trafficking and substance use, including the shared vulnerabilities and impact on survivors. We also wanted to elevate survivor voices in shaping policy and program recommendation, and then wanted to strengthen partnerships between organizations, agencies, and stakeholders. One of those partners is the Link, and now I'm going to introduce Beth Holger, who's the CEO, to talk a little bit more about sex trafficking and what that looks like in Minnesota.
Thank you. Welcome up, Beth.
Thank you so much, Chair Chavez, Vice Chair Wansley, and members of the committee. I just, first of all, on behalf of all of the young people that we work with at the Link who are victims of trafficking or experiencing homelessness, thank you all so much for your long time and recent commitment to helping those who are victimized by sex trafficking and homelessness. So thank you so much. I'm very proud to be a partner in this work, was able to refer for youth survivors of trafficking to be engaged in this project. So it's a great partnership with the city and survivors and us. And just some data on trafficking is that in 2019, we now have some better data in regards to human trafficking across the state. The Minnesota Student Survey, it took a while, but they were able to add the question of, have you ever exchanged sex for something or sexual activity for something of value? And so we do have some data now across the state and in the West Metro, more so than we did in years past. The one thing I do want to say is it only surveys 9th and 11th graders, so it's by far an undercount on those that are experiencing human trafficking in our communities. But what it found was that 1.4% of 9th and 11th graders answered yes to that question. And what that means for us in the West Metro area is in the West Metro, there was 179 schools that participated in the survey, and nearly 14,979 students to be exact, in 9th and 11th grade took the survey. 1.3% versus the 1.4 statewide answered yes to that question in the West Metro, which equates to about 195 students here locally in the West Metro that answered yes. And again, only 9th and 11th graders, so it's very, and also those that felt comfortable answering that question on a student survey and were in school, right? The other thing we wanted to say is just that if we look at prevalence by health-related experience, we did find in the West Metro that more youth that had previous alcohol or drug abuse problems answered, or substance substance abuse answered yes to that question, 18.1, which is not surprising. This whole campaign really talks about the intersectionality between addiction and trafficking, and we find in our work that a lot of traffickers do purposely get youth addicted so that they can keep them in the cycle of trafficking. The other thing we found was that young people answered yes to that question more often if they had histories of mental health or current mental health struggles, if they had ever been treated for mental health struggle before, a behavioral emotional problem, or if they had special education or IEP, or any physical disabilities or long-term health issues. So we just wanted to bring that up, raise that up as well. And the last, the fact I wanted to just say is that we do, like I said, definitely work with youth, young adults, and adults who are victims of human trafficking here in Minneapolis and across the West Metro. And unfortunately, over the majority, or half, this is again, I think, an underreport, but half of exploited trafficked adults were first exploited or sexually exploited as youth. And the average age of entry is between 12 and 14 years old. So, and this is from a recent study with the Minnesota Attorney General. So at this point, I just really appreciate the opportunity for this partnership and the work and support of people who have experienced and been victimized by human trafficking. Thank you so much, and I'll turn it over back to Deputy Commissioner and Carol.
Thanks, Beth.
Thank you. I'm going to bring up Carol Russell to talk a little bit about the campaign and show you some examples.
Thank you. Welcome, Carol.
Thank you, and thank you for allowing us to talk to the subject today. This has been one of the most profound experiences that I've been involved in, and I'm very honored to be able to speak to it. So you heard some of the statistics, you're aware of the problem, you know there are resources available, but what do we do about that? How do you start with that? How do you connect resources with those people that need it most? Our approach is one of co-creation. In other words, we need to start from within. So instead of talking to people, we need to talk with them. Okay, and so what we did, and this was absolutely a credit to the city for supporting this approach, was work with sex trafficking survivors, work with people that are subject matter experts, lived experience, et cetera, and interestingly, work with local artists from the community to say, okay, let's just talk about this. What is the best way to do that? You know, we've been doing this kind of work for over 40 years, and frankly, it would be both dangerous and disrespectful for us to say, okay, what you need, you know, we need to hear what they needed. So we did 2 sessions. The first one was simply to listen and learn, and I'm going to share a couple of the things in a second about that. We were there just to hear them and what they have been through. And secondly, then coming back to them and saying, all right, creatively help us develop the materials that we're going to have out there. You know, these are some of the comments that we heard, so to speak. It was through texting during the discussion. So that, you know, sometimes they were talking to it and sometimes they were texting us because they didn't want to speak to it directly. But it's very profound. You know, for me, it was always fear of no one believing me or blaming me. They make you question your sanity and who you are. Very, very sad situations. These were some of the high-level findings. You know, there is a language, as you may know, within that community. You know, one is, you know, they talk about the life, which I think is pretty self-explanatory, but it's a phrase that they all know. And that's the way they communicate with each other. Also, probably not a surprise to you, but there is a lot of connection between sex trafficking and opioids and fentanyl. That is, you know, it's nationwide, and it's often a trade. You know, you can have this for sex. It is... it's a kind of currency. Also, a lot of emotional manipulation, being told you have no value. You know, you really, you're indebted to me, you are unworthy. One of the most meaningful things to me that I heard said, you know, we talked a lot about what messages would you like to hear? And I remember asking the question, what's the one thing you would want to hear when you're in this situation? And I was expecting them to say, okay, I'd want to know where to go, how close, you know, is help. And they said, you matter, which is a difficult thing to hear. Also, there's a a use of symbolism, which you're going to see in the work, that is something that they understand, the people in that culture understand, but maybe not everybody else does. So it's, again, another way of communicating. And then lastly, it was the call to action. It's like what do we do? At the beginning, somebody had told us, well, maybe it's a billboard and it's got a hotline on it, or it's a QR code and they could just scan it. I said, no, if our trafficker saw us doing that, we would be in danger. We would get beaten. We would, there'd be all sorts of things that would happen. We can't do that. It has to be, essentially undercover. So the work that was developed, we're sharing some of this, it is just filled with symbolism. It's, you can see the freedom. You can see birds and butterflies are another symbol. It's very common. Being released from it. Also, you belong to you. So this is where we get into the messaging of being worthy and that you do matter in their own way. The colors were important, just the interactions, a lot of symbolism, and you're not seeing big phone numbers on a lot of this. And this is also very cool. You can see there's messaging even on the clothing in there, so it's hidden. It's sort of woven in there. And then this one, where these are the things that you've lost. What goes away, money, being able to drive, having keys, having mobility. Those are things that are very important to them as well. And, what did we do with these? These are in many different places, but one of the things that was negotiated was putting the messages in bathroom stalls, because that's one place that they can see it and not have somebody with them. And so you can have some contact kind of information in there. But again, a very profound experience. We're getting a lot of traction with this in terms of people responding to it. I'm told there is a lot of feedback even on a national level for people who have seen it. So again, I appreciate what the city is doing in supporting this, because it is very important work.
Thank you.
And I will wrap us up here with a couple more photos. So we also have a paid and social media campaign. Here are a couple of what those posts will look like. The posts will be running throughout this month and into March. And then we also, that's our social media calendar. My communications director really wanted this slide in here so you can have a snapshot of the social media calendar. So we've got more than a dozen posts over the next 2 months that are planned. And then I'm just going to play a video here of Joy Friedman, who was one of the victim survivors that really helped out with this campaign.
What I want them to know is there's hope. And there is freedom from this. If you're caught up in a situation that you no longer want to be a part of, whether willing or non-willing, I want you to know there are people out here that have put together things for you to be able to get out. Reach out. Let someone know what's going on. There's hope and there's a new life. I'm living proof of that because I'm you.
We've also got these on buses, bus shelters, light rail trains, and digital billboards. The ads will run for 8 weeks on those various locations. And then through a partnership that the city has with Clear Channel, we were able to get 22 billboards donated with space to help us with this campaign. And so that is, hopefully you'll be seeing this around the city. As mentioned, there was quite a bit of coverage on this, and here is just one more little video clip on Fox 9 of the campaign.
Minneapolis, a campaign will launch next week to show people in sex trafficking they can escape.
Fox 9's Rob Olson joins us now. Rob, you heard an inspiring story today. Yeah, from a survivor that's helping launch this campaign. These posters and social media messages will begin appearing next week. The posters in about 30 different buildings in the city, as well as on public transportation as well, helped designed by survivors of sex trafficking to help cater the message here. And now, as I mentioned, helped launched by a survivor as well, who spent years now trying to help spread this message that there is a way out.
It seems like a lifetime ago at some times, at some points.
Joy Friedman was 15 when she was kidnapped, beaten, raped, and terrorized.
They threatened to kill my mom, cut her head off, serve it to me on a platter.
And that is how she says she was manipulated into a life of sex trafficking, a life 4 years ago, and has since devoted herself to helping others find an exit that can often feel impossible.
The thing you got to keep in mind is the unknown, what we're getting out to. That fear alone can keep you trapped. It's like, who's going to hire me? Who's going to love me? What kind of relationship am I going to be able to have, if any?
Joy is now helping raise awareness as Minneapolis launches this new campaign to reach those in that life. A series of posters designed in collaboration with survivors to be placed in public restrooms throughout the city, on digital display boards, and on public transportation. There's also a series of social media images, all of it with a message to everyone to be aware and to speak up.
But also send this message to victims who are out there feeling trapped and helpless because they do not think that they deserve a second chance, or they've been told that they do not deserve a second chance.
Joy speaks from experience of the feeling that there is no life beyond that life. The most important message here, she says, is there is.
There's hope. There is so much hope. There are so many people out here that actually want to hear from us and want to do it the way we need it.
Now, another part of this campaign, too, is looking at the link, the intersection, they call it, between substance use disorders or substance abuse and human trafficking. It's long been known that substances and drugs are often used to manipulate and control people, but they say they're really wanting to take a look at addressing all of those layers to help people escape. Live in Minneapolis, Rob Wilson, Fox 9.
So yeah, we have received feedback from all over the country, as Carol said, and I think one of the most impactful feedback came from a survivor, which is the quote on the screen. "If I had seen these posters while being trafficked in Minneapolis, I would have felt more hopeful and more willing to seek support. Thank you for seeing survivors." That concludes our presentation on the human trafficking and substance abuse campaign that's going on in the city, and I will stand for questions.
Thank you for the presentation, Deputy Commissioner. I'll first pass it to Vice Chair Wansley.
Thank you, Chair Chavez. No questions. Just want to say, Deputy Director Heidi Ritchie, for putting this presentation together, and for our community partners for also coming to support and ground us in the statistics and realities of how this is impacting our young people, and to think of that 100 plus 9th and 11th graders that are unfortunately having to endure this, and then knowing that likely that then they grow up into that 50+%. And really just grateful for you all's leadership in bringing forward something that's very innovative and very strategic in terms of even the placement, and very intentional in the way in which you went about bringing it together and centering the expertise and lived experience of survivors, and also bringing our artist community to be able to capture the essence of what they were sharing with you all to bring forward this campaign. So thank you all for that, and I'm hoping that we are able as a city to leverage examples like this more frequently in the coming weeks and months, especially in light of some of, I think, the mishaps we've learned recently as in approaches to trafficking work, or trying to combat human trafficking. So I'm really excited to have witnessed a positive example in which the city have went about working with our community partners to do it in an informed and in a evidence-based way, and that also centered survivors. So thank you all. And again, I really hope to see this be uplifted in how we continue this work around combating human trafficking and sex trafficking in our city. So thank you.
Thank you.
President Payne.
Thank you, Chair Chavez. I don't think I could have said it better than Vice Chair Wansley. Just a lot of gratitude for this work, and especially how deeply centered it is in survivors' stories to create this work. My question is, our hope is that this is an effective messaging campaign and that people actually take that next step to reach out. I'm wondering if you could share, what's the model of support that we're finding be effective? Because, getting the billboards out there and getting people to call for help is the very first step. I'm wondering what that second and third step looks like.
Through the chair, Council President Payne, I'm actually going to call up either Carol or Beth to take a stab at this question. Here comes Beth.
Back up, Beth.
Thank you, Chair Chavez and members of the committee. What I will say is we listen to young people. I'm learning, trust me, I've worked with young survivors of trafficking and homelessness for over 20 years, and I'm still learning every day from them. So first and most importantly, we listen to them about what they think is going to keep themselves the safest. We take time, listen, and then what they tell us over and over is that, yes, they want adults that are safe in their life, that make them feel like they're mattered, that they're heard, that they're listened to. We get asked and requested a lot for emergency shelter and housing that's trauma-informed and specific for victims of trafficking, because oftentimes traffickers and exploiters are providing, or buyers sometimes are providing housing. And so these young children, youth, or young adults don't have places that are actually theirs, their own homes. So we're providing a lot of assistance with emergency shelter, housing, transportation, and then a lot of them really want they have amazing goals for themselves around careers and different desires and goals around employment and careers, and so really want help and access to pathways for employment. And so we do a lot of actually youth employment opportunities for survivors of trafficking, specifically at the link, because it's tough for them, as you can imagine, to be employed right away in a mainstream employment type of opportunity due to some of the past experiences that they've had. But lots of stories of amazing, resilient young people that have had the unfortunate victimization of trafficking, but go on to great lives once they have that support. So those are the next steps. And I will say, too, a big part of it is also building trusting relationships with youth that are involved in the life, adults. That's huge. I'm always continuing, to always work on that, because once you have the trust of many of the youth in the life, then they tell other people that, oh, the link or Beth, she's cool, you can talk to her, she's going to be there for you, that kind of thing. So just always trying to build up the authentic relationships, too. Hopefully that helps. Is that okay? Okay.
Cool. Next up, we have Councilmember Palmisano.
Thank you for this. Thank you for this presentation. These topics, both these topics today, are really tied together a lot closer than most people realize. As Ms. Holger speaks about in her organization and in the different ways she serves youth, we know that homeless youth, in particular, LGBTQ youth, are often approached for sex for the first time within 24 hours of being homeless. And that's a really tough statistic to know and to not, and to not know how to go and impact these people, these young people.
Councilmember Palmisano, I'm just trying to make sure you're not frozen on the screen and that the public can hear you. Okay, you're back. I'm not sure. You might want to repeat, because I'm not sure if the public heard anything.
Sure. I just wanted to point out these topics are tied together. There is a statistic that says that youth, particularly LGBTQ youth, that are experiencing homelessness within 24 hours are approached for sex. And that's a tough group to figure out how do we best reach them. The idea of these kinds of digital ads in public restrooms are actually probably a good way to try that. Ms. Holdiger's experience in the organization that serves these young people in so many ways is also a good touch point of that. I also want to say that we know, or rather I can share, that this kind of presentation, this kind of work, I don't think would have happened 11 years ago when I was new here on this council. I was part of the sex trafficking work group. It did have the health commissioner at the time, Gretchen Musicant, was a big part of this work, but it was more about business licensing and things that we could do to affect, like our IGR team and our city attorney's office with like prostitution court. And those were the ways that we were trying to have a positive impact to combat sex trafficking. That has grown to what a couple weeks ago was an over 40-minute presentation on resolutions, where we heard from one of the women in one of your advertisement videos, and more. All of the different old and new community partners that are there to help serve this space. So that is a really hopeful message about that. That's where this work has come. It really has come out in the open a lot more. It was not something I used to talk much about as a work group that I was a part of, and a regular participant in, invited in by then Councilmember Elizabeth Glidden. But I'm sure glad that I was, because I've really seen it transform over the years. So thank you.
Thank you. And no one else is on queue, so thank you for the presentation, Deputy Commissioner. Thank you to the community partners, and thank you for the work that you all did with victims and survivors. I think it's a good example of the work that you all are doing to address this issue with community, so I really do appreciate that. All right, so seeing no further questions, I'll direct the clerk to receive and file that report. And seeing no further business before us, I will declare this meeting adjourned.